privilege and a pleasure to be here. I believe that healthcare today is changing more than it ever has in its history, and that pace is going to accelerate over this next decade, and the solutions will be technological, and they're going to come from the entrepreneurs like the people in the room today. So my comments are going to focus mainly on an entrepreneurial view. How do things actually succeed? And where are some of the pitfalls? And let me begin by offering thoughts that why this acceleration is happening is a confluence of three forces. There's the economic forces, the consumer forces, and the legislative forces are all coming together in a way that's going to change American medicine. First, from the standpoint of the economics, healthcare today is the 5th largest nation in the world. American healthcare is $2.8 trillion, and the entire GDP of every country in the world except China, Japan, Germany, and the US is less than that $2.8 trillion. Healthcare today consumes 18% of the gross domestic product. At the rate that it's going up, it's going to double by the year 2030, which would mean that more than 1/3 of every dollar spent in the United States is spent on healthcare. It's a rate that simply can't happen if we want to have education, roads, police, and fire. But it's even more problematic at the federal level. At the federal level, healthcare today costs 50% of all tax revenue. And even if the cost of healthcare inflation only matches tax revenue, because of the changing demographics of the United States, the baby boomers, it will consume all of the American economy by the year 2030. So the economics are saying there's going to be a downward pressure that entrepreneurs have to understand. The second part is the consumer. Understanding what consumers want in the current world. And what they know is that the care they get in the United States today is not particularly good, even with all the dollars we spend. They know that the quality outcomes, whether it's life expectancy or whether it's childhood mortality, is simply in the lower half of the 20 most industrialized nations, and they want something more than that. And try to imagine if the rest of your life were as inconvenient as getting health care. I have a friend right now who just started medical school. She moved to Washington, D.C. She totally furnished her apartment without leaving the apartment. Everything was ordered online, delivered to her house while she was studying to be in school. Now you have a kid who's going to go to kindergarten. And what do you have to do? You have to miss work for half day to go to the pediatrician's office to pick up the immunization form. Try to imagine if healthcare or the rest of the world was inconvenient as healthcare today. But the real accelerator of this change, I believe, is legislative. It's the Affordable Care Act. And the Affordable Care Act, right now, people are talking about the coverage, and that's very, very important. But what's going to become even more important over time are the other pieces that are built into the act itself. And entrepreneurs have got to understand it so that they can figure out the products to create to position into the future. One aspect to that are the exchanges. It's my belief that the majority of Americans will purchase health care a decade from now through an exchange. Why is that? Because that's the way you live the rest of your entire life. I was recently in Japan speaking at the university there. And there were ministers from Thailand and Singapore and Hong Kong and China. And the health minister from Thailand said, "How would you like to meet the prime minister?" I said, "Sure, that'd be great." He said, "The only problem is you got to fly from Tokyo to Bangkok." At a narrow window of time, I called United. I have every status on United. And they could get me to Japan anytime I wanted to go there. But they don't fly down into Thailand. And so I went online. I'm pretty good on the internet. And I looked at every country has its own airlines and tried to figure. And then I went to Orbitz. And I typed in what I needed, which was a flight between 10 and 2 p.m., and I need to come back between 10 p.m. and midnight, and there were the flights to get me there. I get to the conference, and who do I see at the conference? A medical student who says, that's very interesting, because I'm going to Bangkok this summer. But I don't care if I leave Tuesday or Wednesday, because I just want to have the lowest price fare. We use the same online tool for two totally different reasons. That's why I believe that the exchanges, and I'm going to come back to that because the most significant part of the exchanges is what's called the silver level. We don't have enough time to go all the exchanges. There's metal tiers, platinum, gold, silver, and bronze. They've got to all have the same comprehensive coverage. But as you get to the silver tier, 30% of the total cost is expected to be paid out of pocket. And the people in the silver tier have government subsidies because they don't make very much money. And imagine making $40,000 a year, paying taxes, house, etc., and now having to pay a $1,000 deductible. Because you can't have 30% of the cost without a $1,000 deductible. And the entrepreneurs have to understand the biggest opportunity is going to be to solve that deductible. And again, I'll come back to that at the end. The second thing about it is Medicare Advantage. Two forms of Medicare, the traditional fee-for-service and Medicare Advantage. Medicare Advantage is prepaid Medicare. Health plans get money based upon the age of the people, the sickness, but also based upon the star ratings. The star ratings will give you up to 5% more dollars. Healthcare is a 5% industry. Everyone in the world wants your help, entrepreneurs, to get you to become a 5-star program. If not, they can't be successful inside Medicare Advantage. And the final piece is actually not part of the Affordable Care Act. It's actually part of high-tech. And it essentially was the fact that physicians were given $44,000 to put computer systems in their office. And they've got to do it for meaningful use, not just claims and billing. They've got to do some kind of connectivity. And today they have no idea how they're going to do it. And the entrepreneurs are going to have to help them figure out how to use those machines to achieve meaningful use. The one brief thing I'll say about Kaiser Permanente is we in Northern California have 3.6 million members, 44% market share. Last year, we saw 18 million people in person, about 5 visits per person. Last year, we did 16 million virtual visits. Our in-person visits are essentially flat. Our virtual going up 10% a year. By the year 2016, we'll do more virtual visits than in-person visits. That's the future of where healthcare is going. And again, come back to that, and the role of the entrepreneur will be to facilitate that process. So let me start with why I think many of the technologies fail. I'm going to give you just 4 examples today. The first one is they try to solve the wrong problem. And we have monitors now, and I apologize if anyone in the room is coming from companies that are developing these. They're going to send constant EKGs out, or actually rhythm strips, blood sugars or blood pressures, as though the problem is we don't have enough data. But it's not true. 98% of people's heart rhythms don't really change very much, or at least not in a significant clinical way. So the total marketplace for a continual device is 2% of the marketplace. It's not a good place to start. And even in that 2%, the problem is not that we don't understand the rhythms. The problem is we have problems controlling the rhythms. So all of that data going to the doctor's office doesn't add any value. Who's going to pay for it? Who's going to buy it? And if you're a physician, do you want all that data in your electronic medical record? It's not the right problem to solve. It's an interesting technology. And the same is going to be true about hundreds of blood pressures or hundreds of blood glucose monitoring. The issues are not about data. It's about solutions to the data problem. And so the wrong problem is being addressed. The second issue for entrepreneurs is the same one in every area. It's what some say I teach at the business school. It's true for every area of technology, which is how are you going to monetize it? And healthcare is more problematic because there's so many people who could pay for it that no one wants to pay for it. So let's take a problem. Let's take actually the best problem to address. If you can take on one healthcare problem, what's it going to be? Heart failure. Heart failure is perfect. First of all, it's very expensive. You come into the hospital with heart failure, you're in the ICU for 3 days, you're in the hospital for another 4 days, very expensive. Number 2, we actually can predict when you're going to come in the hospital. Whether we measure your weight, because heart failure, the blood backs up. I know there's a lot of ICU physicians here, so I'm talking to them. But some people who are technology people, the blood backs up, water builds up, you gain some weight, we know it's going to happen. Other ways you can measure it too, ankle swelling or foot swelling. So we can predict it. And number 3, we have a solution. We know how to intervene early to get that water off you before you go into the ICU. It's the perfect disease, and yet, in spite of all the work that's been done upon it, no one's really utilizing technology today to change the course of the disease. Why is that? Because you get hospitalized, and now you're going to go home. And the hospital says, it's not my job to pay for this. You're now an outpatient. It's the physician's job. And the physician says, no, it's not my job. It's the patient's job. And the patient says, no, it's not my job. It's the insurance company. The insurance company says it's the hospital. Everyone is passing it around. No one wants to pay for the programs. And so in spite of the fact that we know what to do, we don't have a solution, a technological solution. It should exist. The technology is there. That's not the problem. It's the monetization. The third thing, for those of you who are not physicians, what you may not understand is that physicians basically get paid on a piecemeal basis. Most of them. This is the fee-for-service type world. The more things you do, the more you get paid. Time is money. Any solution you come up with that's going to slow the physician down is going to fail. Every single solution you come up with that's going to slow that doctor down, and you're going to fail because economically it's not going to make any sense. It's why there's been lack of adequate embracing of the electronic medical record, because it slows physicians down. It's wonderful for patients, it's wonderful for data, it's better for quality. So every reason in the world that you want to have a comprehensive electronic medical record, but it slows doctors down, and that's why the typical physician, even with the high-tech dollars, have been slow to embrace it. And the last thing I was saying about it, some of this is heresy, I understand, okay, is the hype of the big idea. And the big idea today is big data. Now, I'm going to come back to big data where I think it actually can make a difference at the end. But I'll say right now that the idea that says by taking massive amounts of data and running correlations, we're going to understand the etiology of cancer and schizophrenia is fool's gold. We'll get lots of correlations, don't get me wrong. But the etiology is going to be so much more complex that even with the most amount of data, I don't believe it's going to provide the solutions. So I think some of the problem is where the entrepreneur sets off on doing. The second set of problems, I think, is just simply the love of technology. Often entrepreneurs start with the technology and then try to figure out an application. They need to start with the problem and then go to the technology. And the good part for entrepreneurs today is that we live in a very different world than even a decade ago. I interact with a lot of medical students. They're 22, 23, 24. Probably some of you in the room are that age as well. You've never known a world without technology. You were 12 years old when Google came into existence. You were 15 years old when the iPhone came onto the marketplace. You were 18 years old when the iPad came onto the marketplace. To you, this technology is always there, but you don't realize that it all happened in the past decade. In the past decade, a decade ago, in order to use video with Skype with big earphones plugged in, 2 people in the systems, and now it's sitting on every smartphone. Today, we live in a global world. None of this existed a decade ago, and healthcare remains 20 years in the past. The big opportunity, I believe, is to use the technology that exists today to figure out the problems that need to be addressed and apply that technology to those problems. If you were back 10 years ago, you'd have a major problem. You'd say, we have this device. In fact, I'll tell you, the device looks a lot like this. But the problem is we got to buy one for everyone. Look how expensive that's going to be. But that's not the problem today. Everyone has one. And they carry with it 24 hours a day. They sleep with this device. You couldn't ask for a better solution than this device. And this device has everything on it you might want to do. You can access the internet through it. You can send text communications. You can have verbal conversations. You can use it to send a digital picture. You can send video. This device has on it everything you want, and it's ubiquitous today. It's just that it's not used very much or very well in healthcare. And I believe that this is where the biggest solutions are going to come. Whether it be things that interact with it and intersect with it, and certainly Apple's about to announce its product, and Samsung announced its product. So there's opportunities out there. But I think fundamentally it's finding the solutions that sit inside this device. So all I offer you is some thoughts about where I would be looking if I was an entrepreneur. A friend of mine, Clay Christensen, professor at the Harvard Business School, who's written about disruptive technology, talks about the importance of starting with what's the problem you're trying to solve. Until you understand the problem you're trying to solve, you're not likely to come up with the right solution. Let me start with a technology that you know well, the Fitbit. Okay? The Fitbit solves a crucial problem, but it has nothing to do with medicine, by the way. Okay? I know how well I slept last night. I don't need a Fitbit to tell me I tossed and turned. And by the way, if it tells me I didn't sleep, well, what am I going to do about it? Its data is completely irrelevant. And sure, it will tell me how many steps I took, but I can buy a $5 pedometer and tell me exactly the same information. There's nothing the Fitbit adds to my health that I can't do in a lot simpler, less expensive ways. But what's the problem it solves? I'll call it the Christmas Hanukkah problem. All right? It's December's coming. You got the family that you love so close, you want to give them a present. It's got to be priced just about right. The $150 range is really a perfect example. You want it to look real good, real cool, and you also at the same time want it to be a little healthy. What's the perfect solution? The Fitbit. 20 years ago, by the way, it was inline roller skates. All right? 50% of the people who got inline roller skates never opened the box. 50%. But it solved the holiday problem. That's, in my view, what the Fitbit did. But where are the real problems? Okay, the first problem, and I would say I'd start with the patient, what Bassam was talking about earlier. The problem with the patient, number one, is let's go back to those exchanges. 30% of the cost is going to be paid by the patient. You can't get to 30% without a deductible. The deductible will be $1,000, $2,000, maybe $5,000, depending upon how healthcare costs go over the course of time. You only make $40,000 a year, which is why you can get to the silver plan. And your problem is how are you going to take care of that patient's view, which is I can't afford to get the healthcare I know I need. The first set of solutions is how do I get care less expensively? So let's step back. Okay. It's a Sunday morning. You're a woman. You had a great night partying the night before, and you wake up Sunday morning, and when you pee, it really burns. Every woman in this room knows exactly the diagnosis already. She has a bladder infection. Now, those of you who are not physicians have a big problem, which you also know the treatment of that problem, which is an antibiotic. The problem is, in the United States, you're not allowed to prescribe it. If you're in another country, you just go to the pharmacy and get the antibiotic. You can go to the doctor's office, probably on Monday morning, by the way, who will charge you about $80 to $100 to get that prescription. You can go to CVS on the Sunday, go to a retail store, and they're going to charge you to see a nurse practitioner of $50 to $60. But why should it take $50 or $60, not be $15 or $20? I know what you need. All I'm doing is writing a prescription because I'm required to by law. How do you come up with a technology that provides a physician who can solve the problem you have? The problem you have is not pain when you urinate. The problem is you can't get the prescription for the medication you know you need. Now let's assume you need something else. Let's assume you need a CT scan. Now, for those of you who are not physicians, I'll tell you the CT scan is exactly the same every place. Stanford CT scan is no better than the CT scan you can get at 25 other places. There's nothing differentiating about a CT scan. It's a pure commodity. So how much does a CT scan cost? You know more about buying a used car than getting a CT scan. You can't find out how much it costs. There is no easy source. There are companies trying to solve it. How do you as an entrepreneur help people get the blue book of CT scans? How do you help them be able to negotiate? Imagine that, negotiating with Stanford. I'm not going to pay you for that $1,000. I'll pay you $800. It's not here now. It'll be here in the future. Why is that? Because you'll also tell them where they can go for $500. Because you'll know the pricing everywhere in the industry. They can get the care that they need at that particular cost. What number two? Number two, you're looking at the issue of convenience for patients. What do patients want? They would like to be able to get care wherever they are, whenever they want it, in whatever way they want to get it. Again, the problem is the systems don't allow that easily. But you could, as entrepreneurs, be able to accomplish it. Again, everything I'm talking about, there are people out there working on. Why is that? Because now you have this device. Right? Because most of the problems are problems that you can solve with this device. You can make appointments with physicians. You can select physicians. You can review physicians. You can send information, digital pictures. You can have a video conference. All of the opportunities to do it. And we live in a global world. So when in the United States, it's nighttime, it's daytime someplace else. And why should we think and limit ourselves to physicians sitting in the United States for a lot of these problems? Now, again, there's regulatory issues around prescribing, but there actually are not the regulatory issues when you get outside the United States about providing advice. It actually reverts the other way. There's problems inside the United States, but not outside the United States, because they don't have the same restrictions that we do. How do we figure out how to solve the need of the patient? Which is, I have a rash and I want to know what it is. I have a particular problem with my child and I want to get advice in the middle of the night. How do I find solutions that meet my problems, not those of physicians? What's the third area? The third area is the electronic medical record. And if you practice in an institution like Kaiser Permanente or Stanford or some other large institution, we have full electronic medical records. But most patients who get care in the community don't have that. Every doctor, as I say, is just to put a computer system in place. They don't connect with each other. And if you're going to try to solve that problem of the Medicare stars, you need data from every physician the patient sees. Why is that? Because you don't know whether the woman's had a mammogram or not. You don't know the status of the colon screening. There is no way you can have all the details and information because the systems don't all interconnect, but an entrepreneur can solve that. How do we download the applications and the systems from one vendor and make sure it links into another? Now, by the way, companies like Google and Microsoft to try to solve this, what's the basic problem? Patients don't trust companies. So where do they want their full electronic medical record? Same place. They want to carry it with them. And how do you come up with a technological solution that allows them to download every time they see a physician, all the information is then put in place, go into their smartphone and be able to resort it? So their medications are in one place and the past history is in another place and exactly what was done is in the third place, and it becomes their true electronic medical record that they carry with them every single place they go. What's the fourth area? Fourth area is lifestyle. And it's not that patients don't want to exercise, eat well, lose weight, do all the things they want to be doing. It's that we don't have any good way yet to figure it out. There are hundreds of applications out there. The problem is no one has yet figured out how to make one that works. That's what entrepreneurs do. They come up with solutions that actually work, that change things and get outcomes. And the entrepreneur who actually figures out how to have the patient exercise regularly, who actually figures out how to help them have a better diet and manage their weight or reduce their stress, is going to have a very, very, very successful application. And then I'll go even a step further. And it's interesting because I was overhearing a conversation where the table's here. Because what do patients really want? They want to be their own doctor. And as someone was saying at the table back there, what do you learn in medical school? What is medical school really all about, residency all about? A set of algorithms. Now, I don't mean the technical parts of being able to do surgery, but the diagnostic parts is a set of algorithms. And at some point, they get so complex, you've got to have experts called physicians who can sort out the interaction of the diabetes with the kidney failure, with the heart failure, and the depression. But most patients' problems are not that complex. And yes, there's a lot of information available on the internet. Yes, you can read all about your diseases, and you can try to Google it. But we should be able to translate medical thinking and medical logic into an algorithm that patients can use to actually make their own diagnoses so they can figure out when to access that person who can prescribe the medication for them at $25 with much lower cost and expense. And they also can figure out when they need to have sophisticated testing and when they can't. That information is readily available, it just has not been put into a form that yet solves the patient's problem. That they want to be the one to manage the disease. They don't want someone else in the old system of healthcare to do it. There are also some institutional solutions, I think, that are out there. Let me just check my time, so we have a couple more minutes. So institutional solutions that are out there right now. One someone's going to have to solve is the interface with the electronic medical record. Today, the interfaces are very clunky. They were not designed to be clinician-friendly. They were never designed to be on a mobile device. They were designed to be on a computer, taking carts and wheeling them around. But no, they should be sitting on a mobile device. The new white coats we're providing in Kaiser Permanente later this year has one pocket for the iPad and one for the iPhone. That is going to be the way that care is provided in the future on that mobile device and figuring out that interface. And by the way, it's not that hard technologically for a sophisticated programmer to figure out and now make that a data entry so much more easily. Just compare how much easier it is for you to enter your data onto your iPad or into your iPhone than it is to put it into your PC-based computer sitting at home. And the last thing I'll mention is going to be what I said before about big data. There is a role for big data. It's just not the role that people are thinking about right now. The real opportunity, I think, in big data is to tell a clinician, the last 1,000 people I saw, last 1,000 people who had this problem, here's what came out of it. It's taking the EKG and the patient's history and the other pieces that sit in place and saying this patient has an 84, 86, 92, 37% chance of having a heart attack. Now, the clinician's still got to decide. It's not 100%. Do you treat or not treat? That's a physician decision. But having that data based upon a huge number of patients is a tremendous opportunity. The problem is, too, number one, you got to make it available to the physician, which means you have to put it into a form that's easy to access. And number two, it's got to be immediately available. So there are problems to be solved. There are opportunities that are there. But my belief is that the entrepreneurs of the future are going to change American healthcare. They're going to take it out of the doctor's office. They're going to take it out from under the control of the medical establishment and put it into the hands of the patient. They're going to make it more available and more consistent with what happens in retail, what happens in travel. They're going to allow people to have more information and more data, and I believe to achieve better health. I'll conclude by saying there are complex solutions to complex problems that are very complex and very expensive to create, and my expectation is that most of them are going to fail because the problems are just simply too complex and too expensive. But there's a lot of solutions that are out there on devices that already exist and technologies that already exist that can be used to solve the kinds of problems that people have every day, which is how do I get care without missing a half day of work? How do I get care at half of the price of what it otherwise would cost me? How do I get care when I want to get that care? Not when it's convenient for a physician or for a hospital or for the medical establishment. I don't know if the solutions I'm recommending are going to generate as much revenue or profit in the end. But if those entrepreneurs in the room follow it, I can guarantee you what you're going to do is radically improve patients' life. So let me in advance, on behalf of people, thank you for the work that you're about to do.